Good morning. Thank you for joining us. We're very pleased to be able to do this presentation and give you some really good information on the LGBTQ plus diverse communities and healthcare challenges, cancer and beyond. These are the people that will be speaking today, and each will introduce themselves as they start their own presentation. Danielle?
Hello, everybody can hear me. Good morning, everyone. My name is Danielle King. I'm the regional manager of the Proud Gender Center and also the Babs Silverstein Proud Center. Um, we are an LGBTQ service line that was previously kind of separated, but now coming together. So I'm going to go over both centers. So the Proud Gender Center, at the Proud Gender Center, we have basically a network of different physicians. So we have top surgery, we have vocal surgery, we have speech pathologist. We also do HRT through our endocrinology department. We all kind of come together and create a network of providers for the LGBTQ community, and this is for the Proud Gender Center. But the Proud Gender Center is basically like a referral hub. So there's two navigators, Daniel Fernandez and James Valentin, who we just hired. And through them, the biggest thing that we do is our support groups. It is very important that the LGBTQ community have a space for just them to see other people like themselves and to also even speak the language that they speak. So we have Proudly Me, which is 18 plus, and it's for anybody who identifies as transgender. We have Orgulloso is a Spanish speaking group specific for the trans Latinx community. We have Proud Transitions that is for a family support group. And then we have our pre and post op support group. And we're actually about to start a Black and Proud trans support group within the next few months. So the Babs Silverstein Proud Center, which is completely separate from the Proud Gender Center. The Babs Silverstein Proud Center is located in Somerville. It is actually New Jersey's first LGBTQ health center that is attached to a hospital. I am very fortunate to be the first hire of the program. I started here 6 years ago. When I first started, we had about 80-ish patients on a wait list. We were only working one night a week. Our office was in the back of a medical records room, and we were running through SFP, Somerset Family Practice. Um, we, I got tasked with getting more people in to get more space, and within, I would say, my first 4 months, we had a wait list of almost 300 patients, which helped us move into our own facility, have our own providers. So now, as you can see, that picture right there is our actual team. Um, we've gotten quite a few awards. I'm very proud of us. We see about 3,000 patients now. We do primary care services, hormone replacement therapy, PrEP and PEP, which is a very big deal to us. We have a therapist on staff, and we're currently hiring another. If anybody knows anybody, send them my way. We also do a lot of education and training, and we have grant funding, which definitely sets us apart from other facilities. We have hotel vouchers for our homeless patients. We have food vouchers for patients who don't have any money for food. We also pay what we call door to door. So we bring our patients to and from appointments. Through our grants, we can cover them for their appointments, blood work, and seeing a mental health clinician. Um, I'm very proud of what we do. And we also are we have rolled out a HIV take home kit for individuals who are nervous about getting tested, or maybe they're not in a monogamous relationship and they want to test partners that they're with. So at the Babs Silverstein Proud Center, we really, really try to make sure that we encompass everything and think about the person as a whole. And also at Somerset, one more thing to add, we are about one of a handful on the entire East Coast that offer bottom surgery for trans women. So I'm happy to be here.
Hi, I'm Rose. I'm one of the social workers here at Rutgers Cancer Institute. So myself and Joan and Stephanie work here at Rutgers Cancer Institute, which is New Jersey's only NCI designated comprehensive cancer center. And we offer a range of accessible clinical trials throughout the state, supported by the latest health-related research and education. This program partially developed as a result of wanting to promote awareness of the concerns and barriers to healthcare that the LGBTQ community may experience. So Rutgers Cancer Institute and RWDA Barnabas facilities are really striving to provide inclusive environments to serve the needs of all the diverse community. And we, like you at Project ECHO, are working to enhance best practice specialty care and reduce healthcare disparities. So thank you for attending today. Next slide. So related to agenda and learning objectives, we're going to review current LGBTQ plus terms, explore myths and misperceptions, look at barriers to care and maybe why some of those exist, discuss how we provide respectful, appropriate interaction with LGBTQ plus individuals and all, gender diverse folks.
So we thought we would lighten this up a little bit and maybe you can guess who these famous people are. You can type your response in the chat and Gabriella will look me at that. So this is a very important person in New Jersey. You can guess her name, just type it in the chat. And that's Babs Sipperstein. You can read about her here. I had the pleasure of meeting Babs a while back. And it's thanks to her advocacy for the transgender community that people are able to change the gender markers on their birth certificates in New Jersey without having to undergo affirmation surgery. So we have a lot to owe this lady.
Joan, I apologize. I don't mean to interrupt you. Your audio is a little low. I think it's coming off a little low on this end. So I just wanted to ensure that everybody can hear you. But
thank you for pointing that out. Is this a little bit better?
Yep, that's better. Yeah, we couldn't hear you before. Thank you. I didn't mean to interrupt.
No, I'm glad that you did. So anyway, this is Babs Sipperstein, and she's definitely a hero in New Jersey for having advanced this legislation saying that trans folks do not need to have affirmation surgery in order to get their gender marker changed on their birth certificate. So here's another. If anybody can guess who this is.
I'm sorry, Joan. We do have somebody in the chat who says they have their volume at 100 and continue to have a hard time hearing Joan and Rose.
Okay. I'm not sure.
Sorry to interrupt.
It's okay. I'm really not sure. Is this any better?
That seems better. I think maybe if you're closer to your mic on your computer, maybe that might be a little bit better, or the speakers.
All right, well, I'm as close as I can get.
Oh, okay. Yep, they said that's better.
Better, okay.
Thank
so
you.
Guess who this is, please type it in the chat. And you can read her quote. She feels feminine, she feels masculine, she feels energy that she can't really explain. She's just a beautiful, beautiful person. How about this? Any ideas? Rose? You're on mute.
Sorry about that. So some terms, and what's important to understand about terms is that they change kind of frequently. And so even this first LGBTQ plus, now you may hear me say LGBTQIA, which is what I'm kind of used to saying. So additional letters there. So again, there's a lot of information. You're not expected to know all of this information. It's helpful to review it. I think it's helpful to talk about it, and it's important to know that it does change. Okay, so if you do happen to hear LGBTQIA, the I in that instance stands for intersex. And so approximately 1 in 100 Americans is intersex, about less than 2%, like 1.7% of the total population of the world is intersex. And, being intersex is not a disorder or a disease or a condition, though at one point it was considered to be one. It was known as having a disorder of sex development, DSD. And the reason I mention that is that you may still see that term DSD. So just so that you understand that. So this, this umbrella term of LGBTQIA plus is, doesn't really recognize all of the limitless orientations that are possible as far as sexual orientations or gender identities, the whole spectrum of gender identities. But it is an effort to, acknowledge people and have a term that people can feel hopefully comfortable utilizing, right? So lesbian is a woman who's attracted to other women. Gay is a term for men who are attracted to other men. Bisexual individuals are attracted to both sexes. It's important to understand that there's romantic and sexual and or sexual attraction to more than one gender. So, and for most people, that means men and women, but as we are reviewing gender, realize that that can be women and another orientation or another gender identity. It doesn't have to be women and men. Just know that. And probably over 50% of the LGBTQIA population is considers themselves or identify as bisexual. Transgender, a term to describe a person whose gender identity doesn't align with the sex assigned at birth. Okay, queer, another umbrella term for an individual who's not heterosexual or cisgender, and it's a term that has been reclaimed. For a long time it was a derogatory term, and so depending on the age of the person that you're talking to, they may identify themselves as queer, if they're a younger person and feel very comfortable with that term. And if it's an older person, they may feel that that's still a very derogatory term. So, and that may not be the case across the board either, but just know that it's a reclaimed term for some folks. Straight is a term utilized to identify people who are attracted to someone of the opposite sex. Yeah, of individuals who are attracted to someone of the same sex. That's not quite right. I apologize. It's opposite sex. Asexual, people who have little or no attraction to either same sex or the opposite sex. And pansexual, a person who has the potential for romantic, sexual, emotional attraction to an individual of any gender, sometimes used interchangeably with bisexual. Next slide. Okay, so not mine.
Hello. Can everyone hear me? Okay. My name's Stephanie Fierce. I am, as Rose said, one of the social workers at the Rutgers Cancer Institute. And so for this slide, we're going to be just overviewing some terms as it relates to sex and what that means. So for example, the first, assigned sex. So that is what someone is labeled at birth. Baby's born, doctors look, they decide, and you are generally categorized as either male or female. Next is sex traits. So that is referring to the various combinations outside of genitals, such as chromosomes and hormones, that make up the different ways in which someone's sex actually plays out. Intersex is, again, the umbrella term for variation in reproductive or sex anatomy, and it's generally when compared to whatever has been determined the quote unquote norm. There are many variations for folks who are intersex. We do know that there's over 40 different medical terms and for the various ways that sex anatomy can develop in a person. And as Rose said, 1.7% of the population, 1.7% of people will be born intersex. That's about 1 in 2,000 babies. And yeah, next slide.
Okay, so gender expression and sexual orientation are not the same thing. They are two different things. People always confuse it. I think it's hilarious that people always come up to me and say, "Oh, well, who's the man in a relationship?" Sexual orientation, me being a lesbian, doesn't mean that there's a man in my relationship or that someone is taking on that role. Sexual orientation is basically how you identify, but it's separate from gender. As far as gender expression, I present myself very masculine, but it doesn't mean that I identify as a male. So when we're talking about gender expression, it's how you are outwardly, how you dress, how you present yourself. Majority of my family, my entire life, has always called me Danny. I've never worn dresses since like tiny. My aunt would tell you that I fought her when I was like 2 years old to get out of a dress. Literally fought the entire family. So I still identify as being a female. And my gender expression, how I show myself, is masculine. And yes, if you have any questions, please feel free to ask them.
Cisgender, right, is a term to describe a person whose gender identity aligns with the sex trait assigned at birth, right? So abbreviated as cis. And so like for myself, although, you know, I happen to be a lesbian, I consider myself cisgender. You know, my gender identity aligns with the sex that was assigned at birth, right? So again, just highlighting that difference that Danielle spoke of, right? So then you're not expected to you're not expected again to remember all of these terms and realize that gender terms change. And what's probably most important is just to be aware that somebody may identify themselves in a way that is unusual to you or that you're not familiar with. And you may have some discomfort around that. And I encourage you to just sort of embrace that discomfort. You know, it's like, okay, we're talking about gray areas here. And we know that, you know, as human beings, we tend to like black and white, but because that makes life easy, we think, you know, but there are a lot of gray areas and people identify in lots of different ways, right? So we're just going to review some of these terms in briefly, hopefully. So gender binary, this idea that gender is strictly male or female. So when we say like beyond the binary, we're talking about not limiting people to just male and female gender identities, are not just seeing it that way, right? Gender conforming are people their gender expression is consistent with what you would necessarily expect, you know, socially, culturally. It meets the expectations of what people expect. Gender diverse, someone whose gender expression is different from the conventional expectations of masculinity and femininity, okay? Gender expression, again, that is how one expresses themselves. You know, I have friends who consider themselves, who are transgender. They may be a trans female, they may decide to continue to keep their facial hair, and that's part of their gender expression. And that may feel very, very different from what people would expect from the conventional expectations of masculinity and femininity. But again, gender expression is a very personal thing, and it's how somebody expresses themselves, and that may change, that may be very fluid, but that's gender expression. Next slide. Gender fluid, a person whose gender identity or expression shifts between masculine, feminine, male, female, or falls somewhere along that spectrum that isn't necessarily identified in one sort of black or white way, right? Gender identity, a person's, this is your deep-seated, this is, your gender identity is that deep-seated sense of who you are, whether that's male or female or neither of those or both of those, right? That's that gender identity is a very personal thing in the way that people identify themselves. Even if they don't speak that out loud, it's their own personal identification. Gender marker is the designation of either male or female that was put on a person's birth certificate. Now, if you've happened to have the opportunity to change your gender marker, then that's a wonderful thing. It's not available in every state. But that gender, that's what the term gender marker means, is to be, is how something is identified on a legal piece of paper, right? Gender nonconforming are individuals whose identity and expression are perceived as being inconsistent with the cultural, social and cultural norms, right, for that gender. So boys or men who are considered not masculine enough for whatever reason, or girls who are considered not feminine enough, tomboys, and things like that, gender nonconforming. Gender queer, somebody whose gender identity and expression is neither man or woman, or is in between or beyond genders, or a combination of genders. This would be a term for the most part that, somebody would say that that's how they feel, or that's who they are, and not something that you would assign, to someone else. Non-binary, a spectrum of gender identities and expressions, often based in the rejection of the strictly binary male-female, terms, because those binary terms are really based on those the sex assigned at birth, and has not much to do with somebody's gender identity. Transgender sometimes is abbreviated as trans, a term that used to describe a person whose gender identity doesn't align. It's incongruent with the sex that they were assigned at birth, with the sex traits that were identified at birth, and then they were given that that gender marker. Queer, again, is an umbrella term for a range of people who are not heterosexual or cisgender. It's been historically, a slur, but in some communities, commonly among people who are on the younger side. Sorry, I read the chat as I was trying to read the slide, so I apologize for that. But this has been a term that's been reclaimed. So again, some people may still consider it derogatory, and but it's been a reclaimed term for some young folks. Next slide. All right, so just a few more here. The basic message here is when somebody tells you who they are, believe them. And it's okay to ask, if for what they mean by that, or what that means to them, if you don't understand the term. Okay, so agender, again, is a person who reports feeling the other male or female. They may have no gender identity, or they may identify as genderless, or gender neutral, or gender diverse, right? Bigender refers to an individual who experiences gender identity as two genders at the same time, or whose gender identity may be between two genders. Maybe masculine and feminine, or it could be between diverse gender identities. Doesn't have to be, again, between those two binaries, right? Pangender refers to a person who identifies as all genders. So demi-boy and these are terms used to identify people who partly identify as male or female, partially identifies, but not entirely. Okay, Two-Spirit is a indigenous term. It's used by people to indicate the embodiment of both masculine and feminine spirit, sometimes used to describe Native peoples of diverse sexual orientation, and has some nuanced meaning depending on who the subculture, indigenous subculture is. Next slide.
All righty. So before we move into taking a look at some graphs, does anyone have questions they want to pop into the chat about the first half terminology and things?
There are no questions in the chat yet.
All righty. All right, so the graph that we are looking at right now is from a telephone poll conducted by Gallup, and it is looking at the LGBTQ plus identity by generations. And so if you take a look at this graph, it's starting from the silent generation, well, from the end to the top, silent generation to Gen Z. And so the graph, it's quite small. So I'll just name that for the generation, silent generation is identified as anyone born from 1949 and earlier. The baby boomer generation would be 46 to 64. Gen X would be 65 to 80. Year 1965 to 1980. Millennials would be from 1981 to 1996, and Gen Z is from 1997 to 2005. And so this is just a representation of what folks were willing to share over the phone during the poll. And so I just want everyone to take a moment and maybe think about what some contributing factors may be to the noticeable shift and increase in the percentage of folks who identified in this poll across the generations. And if you're feeling up to it, or you can add in the chat maybe what some of your ideas may be about that difference that we see. All right, so this next graph is from the Williams Institute, I believe. And this is a graph that's kind of giving us a look into the comparison of individuals who have identified as LGBT across the states. And so one of the things I noticed looking at this poll is that there is a marked difference in the number of folks who identify in Washington, D.C. We are right here in the middle, New Jersey, with 4.1% of our population identifying as part of the LGBT community. And then if we piece that out by gender, we'll see that 48% male, 52% female, and 25% of that population is raising children. Yep, and here is another graph. This one specifically about same-sex couples and households. So we can see again on the graph that DC is measurably different. New Jersey we'll see in the slot 21. And so this is just a deeper look into what folks look like in our area, how folks are identifying, the families that are being built in our area as well.
Okay, so here's
Next slide.
Who am I? If you have any ideas, just type them in the chat. Give it a second. She is famous, and her name is Danica. And if you remember a couple of years ago, she was part of a political race and she won. And the press tried to posture her as just, being transgender, and that was the reason she was running. And she just stayed with the facts and won the race.
I'm just letting you know you're kind of hard to hear.
Okay, I'm sorry.
I don't know if your mic settings are maybe low.
Feel free to jump in, Danielle or Rose or Steph.
Okay, so pronouns and gender neutral titles. Pronouns, the most important thing to know about pronouns is that they're individual to the person. They're not considered their preferred pronouns. They're their pronouns. Now they may change their pronouns at some point. And that's certainly, their prerogative, but they're not preferred pronouns. So, he, him, her, his, she, her, hers, which is my, pronoun, and my pronouns, they, them, theirs, and there are others. So again, just if somebody tells you what their pronouns are, believe them, and they may change, but again, that's those are their pronouns. So as far as titles go, here in the United States, we're not super huge on titles, although there are places, especially I think in the United Kingdom, where like you have to put a title on, on an application or a certain piece of paper. And so here are some gender neutral titles that you may come across, right? MX, mix, right? For those who don't want to be identified, by any gender. Miscellaneous, misc for miscellaneous. IND, for individual, Meyer for mystery. You have a mixture here of Ms. and Sir, and also per, for person. And again, you may come across other gender neutral titles. Again, not super big here in the United States, but people are striving for ways to have neutral, gender neutral ways to identify themselves. And that includes titles where they have to be used. Next slide, please. As far as transgender and gender diverse populations, so there's been data taken for years from the CDC, right? For between 2017 and 2019, that's where this information is coming from, right? 1.6 million people in the United States identifying themselves as transgender, and that would be adults, and then 18 and old, so adults 18 and older, 1.3 million, or 5% of the adult population. Youth 13 to 17, 300,000, or 1.5% of the youth population. And this information is, basically it's self-reporting, so it probably can be considered low information, people not identifying. And so, but this is the information that we have, best approximation. And we don't actually have any good information about non-binary individuals as far as population. So common myths, and these are certainly myths and misperceptions, but they're fairly common, right? That all transgender transitions are the same. They look the same. Everybody has surgery, or everybody goes through the same type of transition. That when it comes to transgender people, they all get surgeries, that they all identify as gay. This idea that there are only two genders. Now, you heard Stephanie say that there are more than 40 variations of ways to be intersex. So that being the case, then there clearly are not only two genders, right? Transgender people are all mentally ill. Transgender people experience, all transgender people experience gender dysphoria, which is not true. Just a word about gender dysphoria here, because we don't really describe it anyplace else in this presentation. But gender dysphoria is the term utilized by the DSM-5, five something. I apologize, I don't know the initials after the five, but it's from the it's from the Psychiatric Association, and it's a classification, right? So gender dysphoria used to be known as sexual identity disorder, right? So the disorder was actually feeling different than the sex assigned at birth. That was the disorder. Gender dysphoria is the discomfort or dysphoria associated with the incongruence of identifying differently than the sex assigned at birth. So it's the incongruence, it's the discomfort around that incongruence, and it does not relate to the prejudice you might experience as a result of identifying as somebody who's transgender. That's a whole different thing. So gender dysphoria is not something that everybody who is transgender experiences. There is criteria in the DSM, and that criteria is for adults, adolescents, and children. So this idea, the next misperception or myth, anyone under the age of 18 is developmentally and psychologically too young to know they're transgender. So if you, so they would not have classifications and criteria that you have to meet, that would have to be met in order for somebody to be diagnosed as having gender dysphoria for children and for adolescents if those people did not experience that gender dysphoria, right? So so this idea that if you're under 18, you can't know your gender identity. You can't know that for sure because you're too young. That certainly is a myth. Oh, I'm sorry, Joan. I took your slide. I apologize. I just see your face there now.
I asked you to take them.
Oh,
I thought you were reading my text message. I can't adjust my mic, so.
Okay, no problem. Next slide. There you go.
Okay, so this slide discusses disparities that we see with transgender patients and cancer, and there are a number of contributing factors we've laid out in 3 categories from research, discrimination, and data. So research disparities, some contributing factors to that would be things like being diagnosed later, less likely to receive treatment, having worse survival for several cancer types, including lymphoma, prostate, and bladder cancer. Under discrimination, things such as lack of insurance or discrimination in the medical setting, be that using outdated terminology, being misgendered, the type of questions, even down to the environments that folks may experience when they come into the medical setting, and data. So data for transgender and gender diverse individuals is very limited. It's inconsistent at best. And we can see that current studies show the need to collect gender identity separate from sex moving forward, to move forward research for underserved, transgender, and gender diverse communities. So making sure that data, the questions are reflecting the differences in the language and the understandings that we've sort of discussed already throughout this presentation to get an accurate depiction of the community.
Affirming language, and this is not an exhaustive list, but it's helpful to understand what some affirming language is. So this is language that is appropriate, right? And pretty descriptive, right? So assigned female at birth is really, instead of saying, female to male, or instead of saying real woman, or assigned male at birth, instead of saying real male or biological male, right? So the affirming language here is again giving some information about what is helpful in talking about and talking to people who are of diverse backgrounds, right? And we had, I had talked about two-spirit, and again, that's the kind of language that you would utilize if somebody had identified themselves as a two-spirit individual, not something that you would use to someone who's transgender without them, expressing that. So, these are helpful terms to know. Again, this information is coming from the Philadelphia Wellness Conference, and just really helpful to have it. Next slide, please. So, language to avoid. And again, this is not an exhaustive list, and some of this information may feel unusual. Like, why are certain terms considered something to be avoided, right? So just if you look here, so the term hermaphrodite is a term that used to be utilized when somebody was born intersex, right? And so that is an outdated term. It can be very triggering for some individuals. And again, to say preferred pronouns is language to avoid, because again, it's their pronouns. We have a couple of grammatical errors here, right? So we would never want to call somebody transgendered, a past tense term of something that doesn't, it's not really grammatically appropriate. You would say transgender. And if you were talking about multiple people, right, you would say transgendered people, right? Not transgenders, right? Now, transsexual is a term that somebody might identify themselves as, if, and same with transvestite, actually, they might identify themselves as transsexual or transvestite, but that would not be a term that you would use towards an individual unless they had already identified themselves that way. And so although these are, outdated terms, there still is evidently, criteria in somebody can still be designated that medically, and which was very surprising for me to learn. So what we're trying to do is to talk about best practices and trying to talk about affirming language, right? And trying to help people feel comfortable and avoid language that's going to be triggering for individuals. It's helpful to know what can be triggered, what can be triggering for individuals. Now, we're not going to get it right all the time, right? And there's always a learning curve. And if something happens, like you've misgendered someone, or you've used a term you wished you hadn't used, you just apologize and move on, right? Don't belabor the point, because then you other them even further, right? And that makes for an even more uncomfortable situation. Next slide, please.
All right. So, since 2023, there was more than 525 bills that were introduced in 41 states. 220 of those bills have explicitly targeted the transgender community, and 76 of those bills have been signed into law. So what does that have to do with us? We think that we live in New Jersey, where our policies and our officials reflect what we're asking for, but there are loopholes. What we're seeing at the Babs Silverstein Proud Center is that patients are getting bills back for $2,000, $3,000, $4,000, $5,000, and we're trying to figure out why. And I look at the back of their insurance card, and I see that their company had bought their company that they work for in New Jersey bought their insurance plan in Arkansas, or they bought it in somewhere like Texas, where they have laws where they don't cover transgender affirming care. So whether it's preventative care, whether it's them getting normal blood work, it's getting denied because the ICD code is attached to their chart. So it is affecting us, and that's why we have to make sure that that we're staying on track with these things and also voicing our opinions when we're having conversations. Next slide.
All right, so while the US Census definitely has been increasing its measures to be able to accurately report LGBTQ plus communities, many folks in the community still remain what we might say is in the closet, and those are catalyzed by a lot of contributing factors. Factors such as stigma, so whether that's lack of family support, whether that is the political environment, cultural marginalization, cultural differences in opinions. There's denial of opportunities, so setbacks in education, employment discrimination, barriers to getting legal ID, barriers for immigrants, healthcare and social service barriers. And then there's also other increased risk factors, such as intimate partner violence and sexual assault, engagement in sex work, poverty and homelessness, and other physical and mental health disparities. And so in this sort of graph or picture that we're seeing, we can see that these things they don't operate individually. They can be overlapping and intersectional and be compounding, which then can lead to an increased risk of violence, an increased risk of the lack of visibility. And that is, not even adding the other combination of various other forms of stigma or discrimination, such as racism, sexism. All of these things can play a part in creating these environments that do not magnify the safety of folks who are different. Folks in the LGBT community may not feel safe due to a lot of these things.
Okay, so barriers to healthcare is mistrust for the healthcare system. And as we're talking about systematic things, so if you just look over, what I always tell people is to look over your intake forms. See if you have an open space for when you write gender. You can have sex assigned at birth, but also have a space for gender identity. Also have a space for preferred name. Also have a space for pronouns on your intake forms, because that alone, when patients are filling out those intake forms and they see that those things are not there, they're going to perceive that already that wherever they're going is not a inclusive environment, so they're not even going to want to go. So for some best practices, make sure that we have inclusive environments. When you walk into the Babs Silberstein Proud Center, we have a large LGBTQ flag. I'm not saying you have to do that, but I know for me, going into a provider's office and just seeing all pink when I go for GYN, and ooh, cute little mom and dad photos and stuff like that, it doesn't feel inclusive. Just having something like a LGBTQ specific magazine out, or having one of those little small LGBTQ flags in a pencil holder. For us, we spot those things and it makes us feel like, okay, you get it. Using inclusive language, asking people what are their pronouns. Don't be afraid to ask what are your pronouns. For us, we don't view it as something that's disrespectful. We view it as, oh, all right, the person gets a little something. As I said, documentation, making sure that you have proper documentation. using the patient's pronouns and their gender affirming name is also extremely important. Um, uh, Make sure that you're listening to the patient. If they're telling you, oh, I'm coming in with my wife, don't do things like, oh, you can bring your friend in. For us, it's very disrespectful. So again, it goes back to mirroring language, and being inclusive, and making sure that you have places that you know of that are resources. So if you know you need to send a patient to, I don't know, a GYN, because I already said GYN, knowing where you have an inclusive LGBTQ friendly provider. You would think in this day and age that, oh, I can just send them anywhere. But honestly, you can't. I went to a GYN's office, two of them with our physician liaisons. And I did, met the entire team, spoke to the doctor. I let her know, hey, we're looking for a GYN that can help take some of our patients. After we do a PAP, there's something abnormal that goes beyond our scope because we're not GYN. So we need to send them to a GYN. And the GYN legit said to me, I don't know how to treat trans patients. And I said, for a trans male, you're going to treat them the same as you would for someone else. And she straight said, I'm not comfortable with it. And you would think in this day and age, 2024, this happened a few months ago, that we wouldn't be having that, but we do. And don't leave it on our patients to go look for that, because a lot of that happens. And again, that's what creates barriers to healthcare. That's what creates mistrust for the healthcare system. So make sure you know who you're referring to. You can always send them to us. We have navigators. We send people, doesn't matter if Atlantic sends us people, Hunterdon Medical sends us people, Hackensack sends us people. They say, hey, we need ortho for this person. Do you happen to have somebody who's LGBTQ friendly that you've done training with? Yes, we have a whole entire resource. So you can always send them to us. They don't have to be our patient. They can remain your patient, but we can help them find other services. Next slide.
So things to think about. So you've just heard Danielle talk about some what I would call, for the most part, micro invalidations, right? Ignoring the fact that somebody's gender identity, how they identify, ignoring why that's important, right? Ignoring the need, right? So if we're talking about microaggressions is really the umbrella term here. We're talking about potentially three different kinds of things: micro assault, micro insult, and micro invalidation. So something can be intentional and meant to be harmful, which would be considered micro assault. Rude, though unintentional statements, and then the micro invalidation is when something is being, when someone is being ignored, minimized, related to how they identify. Next slide, please. So here are some just general micro assaults, micro insults, micro invalidations. And I would say, I'm pretty comfortable saying this, to be honest with you. I think all of us have been both the recipient and the perpetrator of some kind of microaggression, whether we knew it or not. If in some way, if we're othering someone else, I remember I grew up out in Hunterdon County, and I remember when I moved into this area, the New Brunswick area, which is more, it's a more populated area. It's a much more diverse area. And I remember driving through certain parts of maybe New Brunswick and locking my door and having to check myself. It's like, well, okay, why did I not feel like I had to lock my door, my car door, when I was driving through Hunterdon County? First of all, it's much more rural, but there were things that I found myself doing, and even if nobody else saw it, it was actually, my reaction to something different, right? And my othering people that I somehow didn't know or didn't understand, right? So I'm not going to read these to you, but most of these seem understandable, to folks. And so, you know, something as simple as saying to someone with a hint of surprise, "You're so articulate," to somebody who maybe you don't expect to be articulate because of how they present, whether it has to do with their race or their gender or their gender expression, right? Or you're different. You're not like most other people like you. These are micro insults, right? And micro assaults. Well, we hear about those. We hear about assaults all the time, and I wouldn't even call them micro, right? When people are treated differently because of how they look, or because of their race, or because of, how they identify. And so, we don't want to avoid looking at the micro invalidations, right? These are when, even if you're saying something that you think is positive, right? When I look at you, I don't see color. Or when somebody says, as a woman, I know what it's like to be part of a minority group, basically just denying your own privilege. And invalidating the experiences of someone else, saying, "Oh, I understand that," when you don't understand what it's like to be, another person. So, again, I'm not going to read these to you, but I'm sure you could come up with your own examples. Next slide, please. So these are very specific sort of microaggressions that we've listed here to the LGBTQ community, and you can, and again, assuming that a person's partner is the man in the relationship or the woman in the relationship. Again, making that very binary, that it has to meet this sort of black and white, how you understand relationships. Referring to, being LGBTQIA as a choice or a lifestyle, or even a preference, right, is a microaggression. Asking invasive questions that you have no right to ask the question of that person, right? What parts do you have down there? Have you had surgery already, or what have you had done? Telling somebody that they don't look non-binary, and I don't even know what it would mean to say you don't look non-binary, but again, feeling free to say something to someone that you have no right to say, and that is an aggression toward them. Or expecting that, if somebody is gay or lesbian, they are going to present a certain way because of the stereotypes that are associated, that our culture associates with that. Or assuming that somebody who happens to be queer can't identify, with straight people. Or asking a lesbian couple, how do you guys have sex? Or again, all very inappropriate things. And not all microaggressions are this straightforward, but they certainly, this is, this list at least gives you things, to think about, right? Excluding somebody who's LGBTQIA from family events, and people might think they have a very good reason for that. Well, I don't know how to explain it to the children, or it might make other people uncomfortable, or you can come but don't dance together, like things like that. Or speaking on behalf of LGBTQ people without letting them have the voice in the room. Let them speak for themselves, or asking someone to share their sex history or share their coming out story, when again, that's a very private thing, and if people wanted to share that with you, they would. And so, in one of the things too that is that's probably misunderstood or very prevalent is that people, whether they're straight or they're a lesbian or a gay person, or however they identify, if they are talking to somebody who's bisexual and saying, well, you just don't know what you want, or you're a lesbian, you just haven't come out yet, or you're a gay man, you just haven't come out yet, it's in general sort of questioning of bisexuality as a valid or legitimate identity, denial of somebody's identity claims in any way, right? Or when it comes to people who are bisexual, claiming not to understand. Well, I don't understand what that is. I don't understand that. And that may come from even somebody's partner, right? So, so there are lots of different types of microaggressions, lots of different, so we just, it's so important to be mindful and be respected, be respectful, and understand, you know, if we make a mistake, you know, we can apologize and move on, but we do have to sort of check our heteronormal bias, and understand, you know, what other people would be going through. Next slide. Oh, so questions for healthcare providers, right? So we are question people. We work in a field where we ask questions because we want to get the best information so that we can serve the person, you know, the best way we know how. And so part of that is through asking a lot of questions. But when it comes to asking questions, we want to be particularly careful. Like, why are you asking the question? Is this something you have to know in order to provide appropriate care? Or are you asking a question to educate yourself on your patient's back? You know, is it a topic you could research on your own? Is it important for the relationship that you hold with this patient? It may be the case that you build a relationship with an individual over time, and you have a question that you really would like to ask them, and it's not really related to their care. Well, you can ask, if you can ask that question, if you've built a close relationship. You know, can I ask you, we've known each other a while, can I ask you this question about this? And if they say no, then you don't ask it, you know. But just, it's not okay to just ask any question because you feel like you have the right to know the answer, right? Be curious, that's natural, but always be respectful and self-reflect, you know, what's my motivation here for asking this question? And before asking specific questions, like I said, ask for permission. Don't assume that a person is taking certain steps associated with their gender identity, taking certain steps associated with, you know, how they identify. People's, you know, you can't generalize people's experience. And one of the things I think that's important to realize is, even though we're using this term LGBTQIA+, it is not a homogeneous group of people with one set of needs, right? These are all individuals. It's we've used umbrella terms, we've talked about terms, but it is not a homogeneous group, and people have very different needs. So related to asking questions, just avoid making assumptions. You know, ask people who they are, ask people what matters to them, ask people where they're at on their journey. And as much as possible, use affirming language, use affirming names and pronouns to avoid misgendering or avoid making assumptions about whether somebody's spouse is a husband or a wife. Just taking the time to pause and look at the individual in front of you and ask appropriate questions, and be appropriate in those questions and what your motivation for those questions is. Next slide, please.
I know the slide was Jacqueline's. I think we were kind of struggling with it the other day. But recommendations for healthcare policies is to provide equitable employee health benefits. So that is including HRT, as well as IVF. I know that's one that many people don't think about, but having access to IUI and IVF is extremely important. And also to some companies have it where they can help you through the adoption process of kids if one so chooses so. This is not a plug for RWJ, but I've been poached by several other companies, and I have actually remained because of our benefits. So when I was trying to build my family and grow my family, I learned that I had a fertility problem, and I was able to do IUI 4 times and IVF 3 times, which resulted in both of my daughters. But I wouldn't have had that opportunity had I had been at another establishment. So those type of things are extremely important. And also when we're talking about policies, this one's not listed, but having the ability to, let's say you have a employee whose legal name is Brandon, but they use Jessica as their preferred name, them being able to have that on their badge is extremely important, and also for safety precautions and reasons. You would want that for them, walking around every day and being called Brandon instead of Jessica is very difficult for an individual. I know at RWJ, I'm sorry, I'm speaking about RWJ, but we have policies for rooming as well for patients. And also on wristbands, we do not put an individual's sex, gender, nothing. It doesn't say anything because it's really not required to be on a wristband. You see that all on a face sheet on the computer. So having policies that reflect your patients and your employees is extremely important.
So some quick tips. Listen to and validate patients and each other. You know, again, there's a learning curve here. Avoid assumptions, maintain appropriate boundaries, use affirming names and pronouns, affirming language, respect confidentiality and be sensitive, focus on individual patient needs, encourage and model gender neutral language and behavior, be kind, be aware of a patient's vulnerability. No matter who your patient is, no matter where they reside, no matter where you practice, patients are vulnerable. They're talking about things that are very personal, whether it's what's going on with them health-wise or other things. These are vulnerable situations. Be gentle with yourself. Like I said, this is a learning, this is a learning experience to be exploring and talking about a population that you may or may not know well. So be gentle, right? Share information and resources, be proactive, accessible, visible, affirming, and where, some of us don't have any control over these things, creating inclusive intakes, forms and other forms. Personally, that's above my pay grade, but I can be vocal about things that I feel are inappropriate. When I notice it, when I see it, and when I experience it as a patient, I can be vocal. Doesn't mean I can change those forms, but I don't have to accept something that feels unacceptable. And so that's it for quick tips. So we have some references, right? The DSM-5 TR, that's what it's called. That I couldn't think of what the stuff was after 5 for the DSM when I was talking about gender dysphoria. But again, we have references. We will make these slides available with the caveat of understanding that the information changes very quickly. So please, if you're going to use this information or use it for yourself, or reference back to these slides, understand that that this is an ever-changing, fluid process, and that terms may change, stats may change, information may change. And so we'll make these slides available with that understanding that that you want to look up what's most appropriate and most accurate if you're going to look at these slides in a couple of years, because they're not going to, the information may be very different. Thank you.
That was wonderful. Thank you so much, Joan, Steph, Rose, Danielle, for all the information. I know we're running kind of short on time, but we do have a few questions that did come through the chat, and I know some people wanted to unmute themselves. So if you have time, I know there was a question, there's a comment in the chat asking about, are there resources for Spanish speakers? She specifically asked, hopefully she's on the call, she's like, do you have or know where we can get these definitions in Spanish? Related to that, do you have any resources on gender inclusive cancer screening languages in Spanish? I don't know if anybody has information on that.
So I actually saw that question and just took a look at some of the resources I was familiar with. I did see that the Center of Excellence, LGBTQ plus behavioral health equity, has actually printed a glossary of terms in Spanish. I can put the PDF link in the chat. And then also I guess maybe speaking to, I'm not sure about inclusive screenings, but speaking to language, the American Cancer Society has also published an inclusive language and writing guide that could be helpful in developing those things.
Perfect. Thank you so much. That'd be great, Steph, if you could drop that in the chat. So if anybody wanted that resource. And then I actually myself had a question. I know I was listening to Danielle speak and I was wondering, is there a resource where we can find like doctors who specialize in specific like LGBTQ plus care? Like if you're looking for an OBGYN or primary, is there a place you can go? I know you can go online and look for doctors, but is there anything specific where you can find someone who specializes in that type of care?
I know that Garden State Equality had started the LGBTQ map. That's one place that you can go. And the other place is on our website. We have a link for where you can ask for information for like GYN or primary care or whatnot, and we'll send you information. And then you can always send us an email with any information that you're looking for, and then we can also find it that way as well. And I'll put our email in the chat.
Awesome. Thank you so much. Anybody else have any other questions? Feel free to unmute yourself or if you want to drop it in the chat.
Yeah, I just had a question. I wonder, what are some best practices for healthcare practitioners who engage with the LGBTQ plus population? Are there any resources that they can look for?
The WPATH guidelines is a very good guideline. It really goes through everything. I would highly recommend to look at WPATH standards.
Great, thank you. And any other last minute questions just before I end the presentation, which is some last minute announcements. I'll just give it a minute or two.
The HRC also has a lot of resources and also has sort of a specific category for healthcare professionals. And even just sort of looking at their site right now under the healthcare professional category. Yeah, they have published a healthcare equality index. There's a topic for LGBTQ inclusive intake forms. There's a topic for transgender affirming hospital policies as well. So those are another place that you could look.
Awesome. Thank you so much. I know I'm trying to be respectful of everybody's time, about like 10 minutes or so. So I'm just going to finish a few housekeeping things. Thank you again to Joan, Danielle, Steph, Rose for all of the amazing information. Again, we will also have this available as a resource, the slides later on. I know everyone is probably tired of me talking about Mighty Networks, but we're going to have that on here as well. Again, please make sure to look at the NJC guidelines, also their facility search if you're looking for cancer screenings. And then if you can, we really appreciate it if you were to fill out an evaluation form just to let us know, what we can improve on. Did you love the speakers? Are these topics that are relevant to you and to the communities that you work with? They are dropped in the chat, so if you need any of those links. And then again, we will be posting these slides. Just please give us about 2 weeks to kind of finalize recordings, go through the slides. And again, as Rose had said, please keep in mind that this information does change very quickly. So please stay up to date with that. And the presenters today were also very kind to drop their information in the chat. So if you have any other questions or just would like to reach out to them, please do. They are wonderful. Today's presentation was very informative, and I believe it was finally something that, we needed to have a presentation on. This was something that was highly requested. And then last but not least, we do have a session on lung cancer for next month. So if you'd like to join our sessions, please register. I know you get those emails or those reminders. But thank you again for everyone for attending today. We're really happy to be back, and we hope that all the information today, helps serve you and your community better. So please reach out with any other questions. Thank you again to all our presenters. It was amazing. Thank you, everyone.